Cancer, I think, is probably one of the scariest words on anybody's agenda. But when you hear that word associated with one of your children, it is truly a parent's worst nightmare.
Now in the night, I started to feel like pain in my legs. It went on in the night. I couldn't stop crying.
La première fois quand le docteur l'a vu, le docteur a dit qu'on devrait couper son bras, sinon le cancer allait monter dans sa tête.
And immediately I said, do I have cancer?
Because there's no way that he has cancer. But then to learn that, yeah, he did, it like tore my life apart really fast.
So as a mother of 5, I can't even imagine what it's like to hear the words, your child has cancer. So I went into pediatric oncology because I like to win, and I like to win big. And so giving a child back their life is about the most wonderful thing that somebody could do.
Pediatric Cancer Foundation has been around for 47 years, and luckily we're going strong, and every year we're having major success with our events and our donors and our volunteers. And personally, I feel the reason is because there is no better cause.
Although we're growing, we retain a grassroots feeling. We keep our overhead really low by not renting space. We do everything we can to have every bit of every dollar raised go towards research and trials and cures.
The PCF has allowed us to keep on fighting for children. There's a lot of funding that goes to sort of the major diseases, and so that's what we keep fighting for, is this piece of a very small pie. And part of the reason is that A, it's relatively rare, but children also don't vote, so that's not the big sort of push.
In an environment where it is exquisitely difficult to get government funding, we rely heavily on foundations to keep research going.
The number that is often quoted is that only 3% of the National Cancer Institute's budget is actually devoted to pediatric cancer research.
Money that Pediatric Cancer Foundation provides in order to support this research creates the preliminary data that allows us to compete and obtain the multi-million-dollar grants.
It's important to take risk. If we think about bone cancer, the survival rates today are 80%, but they haven't moved for the last decades, plural. These big federal agencies are not ready to take the risk. However, that's where the foundations like Pediatric Cancer Foundations become critical, because there are people that understand that by taking risks, that's how you move science forward.
Organizations like PCF are incredibly important to the mission of childhood cancer, and completely indebted to them for our 40 years of success.
We are funding projects specifically that are making incredible strides.
Hey Maya, how are you feeling today?
Good.
So the good news is the cure rate for childhood ALL is 90%, but a lot of the medicines we use, of course, have a lot of side effects. And Maya's going to grow her hair all back again, but these medicines, while they're quite effective, have side effects we'd like to get rid of.
Like, imagine not having to go through any of the side effects of chemotherapy. If we could figure out how to harness your immune system or some other type of treatment that has such little toxicities that you don't miss a day of school.
If we sum it up, it takes about 40 human hours to get a drug for a patient. I'm so grateful to the Pediatric Cancer Foundation for providing me with the staff who actually know how to reach out to drug companies and to the Food and Drug Administration to open up single patient trials on a compassionate basis. It allows us to be a doctor.
Little by little, the research has shown all the side effects of chemotherapy and how that can affect both the short-term function of these children and also the long-term effects. And so having therapy early on in the process will really help prevent any kind of like long-term complications.
Every little bit helps. Whether you walk with your family in the walkathon, you bike in the bike-a-thon, you come to the shopping boutique, it is so easy. There's something for everyone.
I think we've been doing the bake sale event for 8 years, and we've averaged $10,000 a year. So right now we're around $80,000 to $90,000 so far raised just on bake sales.
You could be a donor, you could be a volunteer, you could help spread awareness in your community.
people feel good about being involved. It's something where we feel we actually can make a difference.
The monies that are raised by Pediatric Cancer Foundation go to support kids that are your neighbors, your family, your friends.
She came in and Nancy, and I felt like I knew her forever.
We were so touched by the frequent phone calls and everyone checking in from the organization just to make sure that, we had everything we needed.
Having gone through Hodgkin's lymphoma when I was 14 years old, happy to say I'm 13 years in remission now. And Pediatric Cancer Foundation has really been there since my initial diagnosis.
Back in the days when I was starting as a fellow in training, there were no survivors from a stage 4 disease. 30 years later, I can say that at least 50% of these children are going to be cured. I treat them when they were little, and now they're finishing their PhDs and they're getting married.
Our mission is to continue until no child is diagnosed with cancer. We're coming together for a cure, and we won't stop. We can't stop until that is done.